Hello, everyone, and thank you for joining us today. My name is Alejandro Acosta. I'm Equality Florida's HIV Advocacy Coordinator. Thank you again for joining us in this holiday season. We know that you guys are all busy and super zoomed out, so we're very thankful for anyone who is joining us today. The purpose of these conversations we are having is called Unlocking Stigma. It's just to talk a little bit deeper about the everlasting problem of HIV stigma, especially in the state of Florida, but really it applies to the whole country. We are right now in a moment where HIV has been brought back to the limelight thanks to COVID-19. So if there's anything positive that this unfortunate pandemic has brought, is the conversation of HIV back into the public domain. And so we're gonna have here an opportunity to speak about stigma and how it affects different aspects of HIV with different speakers throughout the week, right? And so I am going to exhort anyone who is watching this to share this with your networks, share it on Facebook, share it. We have also a stream on YouTube. So if you have the opportunity, please share it and share it widely. One of the problems that we're having here in Florida is that HIV is criminalized still after 4 decades. And the laws have not been updated since 1986. This presents a problem because it does not account for any advancements in science or of treatment and prevention of HIV. And it still criminalizes behavior that is very negligible and that does not actually transmit HIV. We're going to talk in depth with our distinguished panel of guests today. I am going to start by introducing one of Florida's upcoming Democratic senators. He really is a champion for us in HIV here in South Florida. So I am going to welcome Jason Pizzo first, and he's going to introduce himself a little bit, and then we're going to introduce the rest of our panels. Hello, Senator Pizzo, how are you?
Alejandro, hello, and thank you for having me. I'm delighted to join you guys. I'm wearing a jacket because it's a little cold here. We're outside of Atlanta, Georgia, on some voter registration help for the upcoming Senate race. But I proudly, back home, represent 15 cities, a little over 500,000 people in the Florida Senate, going into my third session, which will start next month with committee weeks. And let's take it away. Let's go.
Awesome. Thank you so much again for joining us today, Senator Pizzo. We also have joining us from Tallahassee, our very own public policy director, John Harris Maurer. And John Harris, thank you again for joining us today.
Absolutely, Alejandro. Thanks for having me on. As Alejandro noted, I'm Equality Florida's public policy director based up here in Tallahassee, literally 3 blocks from the Capitol, where Senator Pizzo works, and where we work on a lot of these HIV modernization issues, trying to bring that perspective into the Capitol where it is so sorely needed.
Is it cold also over there in Tallahassee? It's supposed to be cold down here.
I had to bring in all my plants last week.
Thank you for joining us, John Harris. We also have joining us from the AIDS Institute, another great advocate, the Director of Public Policy for AIDS Institute, Donna Sabatino. Thank you, Donna, for joining us today. If you can introduce yourself.
Hi, everybody. I'm Donna Sabatino. I am the Director of State Policy and Advocacy for the AIDS Institute, but even far more important than that is I feel I'm a nurse, and I've been a registered nurse in the field of HIV and in this fight for just over 28 years in many different parts of, from care, bedside in the early 90s, through working with ACA, Medicaid, as well as working through many other roles, and now with the AIDS Institute. So to me, it's a perfect marriage because I feel strongly that nurses are the intersection between social justice, health policy, and the needs of our patients. So I'm honored to be here, and thanks for inviting me.
Thank you so much, Donna, again for joining us. We do have another guest that we are going to introduce a little later, and she will be joining us to give us the perspective from someone actually living with HIV and how these laws impact and stigma impact HIV criminalization and someone actually living it. So let me just start with the very basics, right? We are talking here about HIV criminalization, as I just said at the beginning of the broadcast. These laws have not been updated since 1986. So John Harris, you are up there in the Capitol working, trying to change these laws, right? We're trying to modernize these laws. Why do these laws need modernization? Can you please give us a rundown of what you guys are doing up there and why?
Sure. I mean, I think the two primary reasons that we're so focused on changing these laws is, I mean, as the title of this series suggests, they are horribly perpetuating stigma against people living with HIV. We know that they are not based in science, and because of that stigma, they're in fact harming public health. And I know we'll talk about that a little bit later in the series, but it's a huge problem for Florida. We know that Florida has been, if not the state with the most new HIV cases and transmissions per year in recent history, then at least among the top states. And it's a really shameful record for Florida to be holding. So we've got to do everything that we can to reduce these new transmissions. And that is so tied to reducing stigma and reducing policy that in fact is a disincentive for folks. Right now, the way our law is structured, it is a disincentive to know your status. And if we're not helping people know their status, then they can't get into treatment. Our laws right now make it a third-degree felony, punishable by up to 30 years in prison, basically, to be living with HIV and doing, the activities of daily life that others do who are not living with HIV. This is everything from even donating blood or tissue can, again, land you in jail. And it's just absurd. It is not tied to science. As you've stated, we have made incredible progress over the decades of living with HIV, and our laws just don't reflect that at all. So when we're talking about laws that can carry these enormous consequences, we've just got to get them in line with science. Right now, they are penalizing activities that have scientifically no risk of transmission, and the laws don't even require transmission to occur. So they're not even preventing a harm that they maybe at one point sought to do. So we've been sitting on these same laws for decades. We're far beyond the point to update them. And it's an issue of fundamental fairness. HIV is not what it was 3 decades ago, 4 decades ago. We know so much more about it. We've had incredible advances in treatment and prevention, and we need to be treating it in law like a chronically manageable condition that it is.
Thank you so much, John Harris. I saw Senator Pizzo raising his hand. Do you want to say something, to add something to that?
I want to just embrace the rare opportunity and unique circumstance where I get to correct John Harris Maurer right now about the term of years involved in a third-degree felony. No, it's just so rare. I had to jump out.
It is 5 years to up to 30 years. So you can have multiple
convictions.
You can have multiple convictions and go up to 30 years. That's the maximum that the law allows to convict someone for HIV transmission or non-disclosure. And actually, let's keep on with Senator Pizzo. Thank you, John Harris. So you are the sponsor for the bill that would modernize HIV laws in the Senate. We have also a sister bill on the House with our representative Nicholas Duran. Why is this important for your constituents? Why do we need to change these laws, and why is the senator interested in changing these laws?
Even if the numbers were static, and they're not, in recent time we've been sort of a hotspot and concentrated area of a growth in cases and numbers of positive cases. Even in a static line, it's really time to unpeel and unpackage just draconian, antiquated, and leave it to a pandemic to really bring to the forefront how to triage some of these situations. I have 14-year-old twin boys, identical twin boys. I think John's met them before. I caught one of them a few months ago watching Eddie Murphy Delirious. I don't know if you guys remember that. No, Eddie Murphy Raw, I think it was. I think it was 1987. And just to put things in perspective about what kids know now that some adults don't realize. This was the skit where Eddie Murphy was talking about your wife goes out and she kisses somebody who has AIDS and you get AIDS on your lips. This was a time when we thought saliva or tears or all kinds of things. We were so completely ignorant. And to hear my son say, that's not true. Like, that's not accurate. I was a little uncomfortable. He was watching that segment, but, you know, watching that whole thing. But it's true. And then you go back and you do a little research. In 1986 is when we promulgated laws in Florida as it relates to the criminalization of HIV. And at that time, we had no idea what actually transmits or what does it. And a number of people were dying. This is a year before the very first drug came out for HIV, for HIV. 1 year before, and we're already criminalizing and setting into statute transmission. Does it disincentivize testing? Absolutely. Does this disincentivize just general medical treatment in general and outcomes? Absolutely. But here we are where it is disproportionately, basically by almost like a tacit blessing of leaving it the way it is, disproportionately targeting populations that are most in need or that we should be helping. Unfortunately, a lot of the people that we saw, I won't say a lot of people, there's a lot of people who feel a certain way, but they need like the overwhelming majority to be in favor. Otherwise, there's safety in numbers. But there are still a few collegiate vestiges of the old world that really have no idea, about the science, about where we are, about treatment. And I say leave it to a pandemic to bring it to the forefront. Some of the things that the stigma that HIV still holds from years ago in the 80s, in the early 80s. And by the way, I looked it up. Eddie Murphy, he says he cringes when he thinks about the jokes that he made and the ignorance that he had. And he said, please, I was a 21-year-old idiot kid. And 10 years later, in 96, he's like, at 35, I'm much more well-informed and I need to message this directly. He goes, I'm cringing thinking about what I used to say and the disinformation that I used to disseminate in those jokes. But here we are where a lot of the old rumors or myths about the transmission are actually true about COVID, through saliva and through shaking of hands and all of those things actually do transmit the crux of the pandemic that we're in, but not HIV. And it's high time. And if anything bittersweet comes out of this, it really shows us how we need to triage these things. I'm going to stop talking.
Some people have actually compared masks to wearing condoms as well, right? They have made that analogy, even though I think that, again, with COVID-19, it just goes so beyond what HIV ever was. They're very similar. They're similar pandemics in many ways, but they're so different at the same time. They're similar because they have affected everyone. I mean, COVID has been so quick. And when we think about these laws affecting, and like you said, Senator Pizzo, access to healthcare is a problem. And we have, COVID-19 has actually really shared a spotlight on the disparities that our Black and Latinx brothers and sisters have, and as well as women and just poor people who don't have access, regardless of race. Again, this has really shed a spotlight. And Donna, you just said that you've been around HIV for about 28 years. And can you tell us a little bit about how do these laws interact with healthcare and public health? Thank you.
Absolutely. And I say this quite often when I'm asked a question like this. We're not too far away from where we were 28 years ago. And that makes me very sad when it comes to what's happening in HIV. We have these very recent examples. I was reading in a couple of magazines out in Los Angeles. There's a lawsuit because a male person living with HIV for about 30 years was trying to get hip surgery. And the medical group denied him because of his HIV status. And we're talking maybe 4 months ago in 2020. And the real sad part about that was he had never disclosed his status to anyone in all of his years except for his healthcare providers. And now here we are putting it right back in his face and increasing that stigma. We hear these stories all the time. And when I worked on the floor back in the early 90s, we had a dedicated HIV unit. And I think, gosh, that's not much different now than it was, because people used to leave their food trays outside the doors at Broward General, where I was in my early nursing days. And nobody would walk in their room to give them their meal trays. And I think about, gosh, here we are. Nobody will do hip surgery on a gentleman who is undetectable and has been on his meds and adherent to his medications, where his risk is absolutely no worse than anybody else because of his adherence to his meds and being denied access to a much needed hip surgery. So I read these things and I sit there and I'm like, my goodness, where have we gone wrong? What have we not done? So, you talk about the treatment side, and then what does it have to do on the prevention side, right? So through my many, many years in the different roles that I've had so many people tell me that they don't want to get tested. And I'm like, well, why wouldn't you want to get tested? You can, take your meds and, live a real healthy life. Not much different than if you weren't HIV positive, getting your virus under control. And it's like, well, because then I'll have to do something about it. Or then I'll have to tell people, or then I'll have to tell my provider, and maybe that's going to be an issue. And the fear that's out there for people disclosing is never, ever ceases to amaze me. I just try to tell them all the positive things about knowing their status. I also think of another link. I could go on forever, and I'm sorry. Just
no, you're fine.
I think of another link between HIV stigma and in general worsening health outcomes, because people aren't staying engaged in care. It's a fundamental cause of these health inequities, is the stigma and the fear and the disclosure. So we really need to figure out a way to help curb this. We also see increased depression. We also see worsening mental health and physical health with people who are living quiet.
Isolation too is a huge problem.
Yeah.
And the aging community right now, since half of the people living with HIV in the United States are 50 years or older. And that is something that at times we tend to forget, that we do have a lot of people who are long-term survivors that have been around since the 80s, who lived through all this and who are still living and kicking and very well and healthy and will be around for a long, long time. Thank you so much, Donna. It really, we could, like you said, we can write books about the intersections of healthcare and HIV. And the fact that you said that in 2020, a physician, right, is denying a basic healthcare need to a patient based on rhetoric and science from the 80s, it's scary, but it's not uncommon. Mm-hmm. It's something that we hear constantly. I have trained medical students. I have gone to universities to talk to students, resident students, and even the open conversation about sex can make a physician, who, by the way, physicians and doctors are human beings as well, right? We tend to put them on pedestals, but they all come with the same as any other human being, with biases and with stigma within themselves that they might not recognize. So it's very, we hear stories all the time. Equality Florida, although we are not a service organization, we do get a lot of people reaching out to us when they find themselves having these issues. And we get constant calls of doctors and physicians denying PrEP, denying the efficacy of U equals U. And Donna, before we move on to another question, I would like you, if you could very briefly, since you are the healthcare expert in the panel, can you tell us what U equals U is? And how do we know that it works?
So U equals U, basically the one U is undetectable and the other U is untransmittable. So someone who is undetectable, what does that mean? That there is so few viral particles in a small amount of blood that it can't be measured in the technology that we have today. So that's what undetectable is. Don't get it confused with a cure. Someone who is undetectable still has HIV, but again, it's so the viral particles, the actual pieces of HIV in someone's milliliter of blood, which is like a fifth of a teaspoon, okay, so a real little bit, is not enough. You can't even measure how much is in there. So, and even Dr. Fauci, his name has been around for many, many years. You know, I know Dr. Fauci from our early HIV days through many presidents, has even said it's not transmittable. Not that it may not be, not that it maybe possibly isn't. It's kind of like I tell people, you're either pregnant or you're not. You're not a little bit pregnant. So when someone is undetectable, they are not able to transmit. And that is huge when it comes to these laws as well. That's a big part of that. So I hope that helped. I hope that's where you needed it to go. So
no, I really, we sometimes give it for granted that everybody knows what U equals U is and that everybody is on the know. And part of the stigma is misinformation and lack of knowledge and education. And in this case, U equals U seems to still escape a lot of people. And when we're talking about the laws, Senator Pizzo, we're trying to change them for 4 major things, right? We're trying to change them so that organ donation can be allowed since it has been legal since 2013. We want transmission to actually have occurred if we want to convict someone of transmission. We want to make sure that the laws match science. And lastly, we also want to reduce and make the punishment, to be equitable to the offense, because right now, as we said before, someone can go to jail for an excessive amount of time. What is the holdup? We have been trying to do this for 3 years. And I cannot help, as someone living with HIV, that stigma is a huge part of why this very common sense law is not passing.
So one concern I have is there have been there's been an exponential increase in an improvement in treatment, right? That I don't want to, at the same time, because last year Representative Nick Duran and I co-signed a letter to the new Surgeon General insisting that he take advantage of the full $70 million of federal funding available for treatment and prevention programs. So I want to walk the very fine line of telling the legislature HIV is not as serious as you all thought it was, but at the same time, it's very serious. We have increasing numbers of cases. We need money and resources for it. So I don't want to talk out of both sides of our mouth, so to speak. So what I do want to do is just use numbers. And this year, again, I go back to, what do we have? 14 million positive cases, 283,000 deaths from COVID. We have 1.2 million people in the United States approximately living with HIV. We've had 16,000 deaths a year from any reason of somebody who was also diagnosed with HIV, which is what we're seeing when the deniers, the hoax people, whatever, are saying, oh, well, they died of a heart attack and they had COVID. They were COVID positive. They died of this and they had, okay. More people have died in Florida this year from COVID than have died in the entire United States from some cause while also being diagnosed with HIV. Just let that set in for a second. More people have died in Florida this year, in Florida, in one state, than have died in the entire United States being diagnosed also with HIV with some other attendant thing. So that speaks to it's not as bad as COVID, so to speak. But at the same time, I don't want to discount it so much that it's just, get a shot and it's over. To Nurse Sabatino's point, which is, undetectable does not mean cure, right? So the holdup has been, it's the worst case scenario, something transmitted that people know about. Okay, that over the years there's been something for gonorrhea, there's been something for chlamydia, but the truth is herpes lasts forever. You never cure herpes, you never get rid of herpes, and I think we need to have some more uncomfortable conversations. The first session that we had this, I was like fighting at the bit to go. Don remembers, and I was told by some of my more senior colleagues on our side to calm down. We're not in a courtroom. This isn't one of your homicide trials, and to just show a little discretion. And I regret not just being me and doing me at the time and just taking the person to task. But these are the same people that sit on the same dais in a meeting and say, you know, marijuana is a gateway drug to heroin, and they say it with a straight face.
Right.
I mean, yes, a couple days ago, one of the more conservative, louder members of the Republican Congressional Caucus jumped over to the aisle, and as we saw, the Representative Gates even co-sponsored a bill by the Democrats to decriminalize marijuana from the federal level. So, you know, do I want to say those are thinning out and terming out and going off to do other things that are still left with that? Yeah, I think there's more. So I think we probably have a sort of a better idea, and we need science. To your third point about using data and science, I need a doctor that says, listen, you would honestly, based on the death rates and based on what we know or don't know, this is the equivalent. Going back to 1986, it reminded me of something else. I'm sorry, but I don't know if you guys remember reading about this, because maybe Donna knows it, but in 1986, there were 3 students, I think it was like DeSoto School District or something in Florida, that were not allowed to go to school because they were HIV positive. It took a court order to say, no, that's not, even back then, like, we know enough to say that shouldn't prevent them from going to school. If you had 3 brothers who are COVID positive today, they're not going to school. If you have 3 kids that are HIV positive, is it okay if they go to your kid's school? The answer is yes. There's no, you know what I mean? I mean, they have to say yes. My colleagues have to say yes to that. But if 3 kids are COVID positive, should they be going to school? No. No, I don't think anyone would disagree with that.
It's you know, like, when I wanna actually reiterate what you just said. Like, one of the issues that we actually have in Florida is a very large state, and we don't have the same access everywhere. So even though there are some people who are on treatment and actually very healthy with HIV, there's also a portion of people living with HIV who do not get access to services, actually, who are prevented from actually getting services because also of the stigma. They might, like Donna said earlier, I have friends who have been living with HIV for years, and their families don't know about it. And they are very open to their friends, and they're very open in their lives, but they're not open with where it matters, right? With their family and maybe at their job. And think about suffering from another illness and not sharing it with those you love the most. It puts a strain on people. And Jen Harris, you've been also over there in Tallahassee. How does stigma, how does it show up there in the Capitol? And I'm not asking for names, I'm just asking for situations.
No, but we've certainly seen it sort of rear its ugly head in committee meetings, which you've been in and Senator Pizzo has been in, where, I mean, lawmakers, very well educated otherwise, today will still refer to HIV as a death sentence, which we just know is incredibly untrue and not related in any way to the science that has been advanced in treatment and prevention. But it does perpetuate this sort of fear that drives this huge overcriminalization response that we see in Florida law right now. So I think in some ways it's a mix of stigma and ignorance. But there's so much work that we can do, and the public education that happens in some of those meetings is incredibly important. And Equality Florida, with partners like the AIDS Institute and others, has been really fortunate in helping to bring people living with HIV to the Capitol to have face-to-face meetings with their lawmakers or to testify in committee to try to reduce some of that stigma, to have a real person in front of those lawmakers who can say, I'm standing in front of you today here alive because I had an organ transplant from another person living with HIV to me as a person who, with fully informed consent and knowledge, accepted that organ and, you know, have been living with it for 20 years. That's really powerful. And even just when we leave those meetings and a lawmaker or a staff member says, you know, I've never met somebody before who was living with HIV. It always strikes me as a little bit funny because it really just means they didn't know that they met somebody,
right.
Probably somebody very close to them who was living with HIV. But there is that stigma, so we don't talk about it. So people don't know it's a thing, and it feels very removed and remote. And so it feels like, well, is this crazy criminalization such a big deal? Maybe not. It's not a priority because I don't know anybody living with HIV. And that's just not true.
Right. It's actually, I have been to those lobby days as well, and the first time I actually did one of those first one-on-one meetings with lawmakers, I was shocked at the fact that they had not, a lot of them, majority of them, had never met someone actually living with HIV, or so they thought. I often tell people, you have met people living with HIV. You just don't know it because they don't, usually don't people go around sharing their diseases or the things that they suffer. It's when we talk about disclosure, and I must say this because it's not being discussed yet. Disclosure is a very important and intricate thing, right? Not everybody can disclose the same way, and disclosure can even bring, someone can put someone at risk of violence. And so because of this stigma, because of misinformation, people oftentimes don't share their status, even to sexual partners. So when we think about criminalization, we're thinking about exactly this. When people are not getting tested, not to get to know their status so that they don't feel that they have the burden of having to tell somebody. Again, this is not, unfortunately, this is not unheard of. So that's why stigma is such a humongous issue. I just got to fly somewhere. I have to apologize for our guest, Aisha Scott, who was scheduled to join us today. She's been having some internet issues and has not been able to join us so far. Hopefully, she will be able to join us sometime before the end of the broadcast. And if not, I already apologize for her. So I want to thank you, Aisha, wherever you are. Thanks, because I know you've been trying.
Alejandro, can I say something about, before I forget in my brain? Yeah. John Harris, you said something really, really important, and I think about this a lot. And until it hits home, right? Until someone in Tallahassee or in DC or wherever decisions are being made, even at local levels, has that impact, and it hits their heart, right? Or it hits them. I think that's a big part of not being engaged and not seeing how important this is as a life-threatening illness for many, many people who may not have access, as Alejandro said, to care and treatment and other issues. So I think about that a lot because, as Senator Pizzo said, there aren't as many people living with HIV, so not a lot of people have been touched. So I just wanted to.
There's not a lot of people living with HIV openly and freely. There's still, at least in Florida, 125,000 that know their status, and we have about 25% that do not. So we're trying to target that 25%, right? That we want people to know their status, and the only way to do so is to be a state that is free of stigma and criminalization. I can attest to what you just said, Donna, right? It's very important to have that impact from lawmakers, but we have right here Senator Pizzo, who I'm not really sure, and I'm not asking Senator Pizzo if you have had personal impact of HIV, but he's a representative of the people in Miami who are directly impacted by people living with HIV, and he is a lawmaker that cares for his constituents, and in this case, he's taking on this challenge. But let me also tell you, Senator Pizzo is an exception to most rules. It's not easy finding lawmakers to take on such an important issue. Also, I'm sure because of stigma. I'm sure some stigma has come your way for taking on this issue, where someone might have asked you, why are you taking this on? That there's no, give this up. This is a gay issue. I'm not sure, again, if you've heard any of that, but I know that this is the type of conversations other lawmakers must have also been hearing, because there's not a lot of people raising their hands to be the sponsors of the HIV advocacy bill, correct?
No. So a little bit about me. I was just raised I was given permission at a very young age to take care of bullies. And bullies take the shape and form of many different iterations and permutations. So I never set out in my young adult life to become a prosecutor that disproportionately handled the shootings of Black and brown boys. Never thought that was going to be, my later or young adult life work. here's the thing. I'm a white heterosexual male. I'm like 24% of the people who become HIV positive, right? The disproportionate number. The higher number that really concerns me is the 13 to 24-year-olds growing in greater number, almost accounting for a quarter. That it's just disproportionately people of color. That it's overwhelmingly inclusive of people in my district. So, you know what? I'm perfectly fine being in the minority of people that are really comfortable with this. The only criminal justice bill to pass last session, John knows this, was a bill that I filed that prevented the shackling of pregnant inmates and solitary confinement of pregnant inmates because a woman had given birth by herself in solitary confinement in a county jail. Well, sure enough, after that was signed into law this year, the same exact thing happened again. And so there's a bit of like, well, you know, why is Pizzo doing this? Well, the irony is I was probably, no, I know for sure, more so than any other of the 159 legislators, probably responsible for many of the people that were in state prisons as a prosecutor. After a successful jury verdict of guilty, a lot of the people that were in there were because of my prosecution. So, but it does hit home, and I think you guys sort of, when you're thinking about the legislators, who should file this, we have, I mean, finally, at long last, you know, openly LGBT lawmakers, you know, now in both chambers, which is wonderful. But I do think that there's going to be a stereotype, you know, if Senator Chevron Jones were to file it, people are like, oh yeah, that's because he's gay, right? Or Representative Carlos Smith, oh, because he's gay. No, I was a really promiscuous heterosexual male in my childhood. You know, does it hit home? No, I'm lucky it doesn't. But
you enjoyed multiple partners. The same promiscuous is very stigmatizing. We're very sex positive here.
My dad says my son loves love. You know, he does, you know, love romance, whatever. But here's my point: is no. But I'm really comfortable in this position, and I just think it's right, because here's the thing. I have twin 14-year-old boys, right? I'm not sure who they love, who they feel for, where their passions are, whatever. But this guy and my wife are not going to be surprised and are not going to be unhappy and upset with however they feel about themselves. Okay? There's not going to be, and we want that open communication and conversation. My dad has a cousin who's probably 71 years old. His mother is still alive, Aunt Ro. I'm outing you, cousin Dennis. You know, she's like 101 years old, and he just won't just come out. We all know. But like, he doesn't want to tell his mother who's 101 and doesn't even know if you're there. I mean, come on. Come on.
You're something else. Thank you so much for that very honest response. I love it. So, you know, that's the idea, right? That hopefully some other lawmakers are going to also see the importance of changing these laws, and they're going to sign on and co-sponsor.
Alejandro, there are a few Republican senators that I serve with who really want to, who really, and John knows who they are, who really want to. And it's kind of like they're waiting for their proverbial uncle to get out of the room so they can go ahead and give a thumbs up. But I think this year we're going to, you know, it's just, sorry.
No, it's interesting because right now we do have a nationwide initiative called the Ending the HIV Epidemic, and that was actually proposed and implemented by the outgoing administration. Bye-bye, we miss you. Not really. And it, you know, we have to also think that this is not, it shouldn't really be a political issue. It shouldn't be a party issue. It should be, everybody should be on board of this. You know, we have seen the effects and the consequences of politicizing a disease like COVID-19. When we do that, we are leaving one party, I guess, in the side of science, and the other one doesn't. I mean, that doesn't really make much sense. And unfortunately, it's sad to say, but it should not be a party issue. It should be embraced by both.
Well, and Alejandro, I think we've seen how HIV stigma has shown up even in the COVID-19 pandemic. Mm-hmm. You know, with these fears about whether there would have to be medical rationing because of these just skyrocketing case counts and, you know, limitations on beds available in hospitals at the beginning of the pandemic, limitations on ventilators, and Equality Florida, along with the AIDS Institutes and other advocates, were really looking at some of these policies that were coming out and how they were looking at prioritizing folks if there was that sort of medical rationing. and they're looking at, well, is somebody immunocompromised? And we have so much public education to do so that people understand that just because you're living with HIV doesn't mean you are dramatically immunocompromised. Donna was telling us about U equals U. And if we don't have good public education out there about what it means to be living with HIV, then, we have these policies that are really prejudicial to folks without any scientific or medical basis. And the pandemic has just been such a reminder that, it's not just things like the blood donation ban from the FDA and their restrictions, but these sort of prejudices and stigmas crop up in our public health in so many ways.
Donna, I saw you were about to jump in there. Thank you, John Harris. Can you add a little bit there?
I can, and it's probably more COVID related, but also something that I'm a member of the Florida Nursing Association and on their policy board as well, policy committee as well. And I volunteer, I do COVID testing up here in Flagler County, and it just burns me that we have to cut off our testing because we don't have enough tests. So people get there an hour and a half early. We start testing at 2:30. They're there at 1, maybe earlier. And we can only do 50 or 60, and then we have to turn them away. I'm sorry, but there should be the budget there. There's a disconnect somewhere, right? It's that old, well, if we don't test, we don't have the numbers. Well, hello. Yeah, it's true. So that's something that when you said COVID and testing and, all the other availabilities, that is something that I live and breathe a couple times a week when I go and volunteer and turn people away.
I think there's a real opportunity right now, especially since we are going to have a session that is upcoming still during the pandemic with COVID-19, which might give an opportunity for people to join virtually. We actually have, I'm not trying to spotlight our lobby days, but we do have, every year we have a lobby days where we bring people from the community to speak to lawmakers. And this is one of the issues that is very important to us during lobby days. We actually have brought in 3 years in a row, people living with HIV, as I said before, speaking to lawmakers. And, this year, because of again, COVID-19, we might have an opportunity to bring many more people living with HIV in front of lawmakers because, to be honest, Florida is huge. And so going from Miami to Tallahassee presents a physical challenge to a lot of people, to constituents who also need to take days off. So hopefully this new opportunity will bring Equality Florida a record number of people living with HIV as well as community members joining us. So if you are out there and you would like to join our efforts of policy change, I recommend that you keep an eye on for Equality Florida's Facebook page. We'll be making announcements about our lobby days very soon. Sorry, had to do that little commercial there.
No, I will just shamelessly reiterate Alejandro's plug there. Lobby Days is one of my favorite things of the year that Equality Florida does. And as he mentioned, this year we're going to have a much longer, more sustained campaign with a lot of this virtual organizing that we're doing in the pandemic. But it's really such an impactful process. Obviously, Senator Pizzo gets to hear from advocates like that coming to the Capitol every day. But it is open to everyone. There's nothing that you need to know in advance. And we very much understand that it can be an intimidating process. Not all lawmakers are as warm and welcoming as Senator Pizzo. But we've seen those advocates who have gone from, being there the first morning of lobby days and being in tears because they were afraid that disclosing their HIV status could put them in jail immediately. And through the process of the training and doing those meetings, really coming to understand how important it was to be sharing their stories. And that same advocate who had been crying 24 hours before, by the end of the next day was walking the halls of the Capitol, trying to figure out how to get a job in the Capitol because they just loved the experience so much and felt so empowered by it. So if you have any interest at all, I do hope that you'll keep following Equality Florida. And I'm sure we'll put up information in the comments about how to get in touch with us to participate.
Speaking of the upcoming session, Senator, are you planning to once again sponsor the bill? Is it going to be introduced sometime soon? Do we have any news on that?
The short answer is yes.
Not to push you in the spot, right?
This session that's the important answer that you want to know. This session might be a little different. That they're going to keep the Senate, I think, in a bit of a bubble for the time being. So we're not going to be able to have people in the building.
I'm very happy for that because we need to keep our lawmakers also healthy.
Right, but you know what? We've never had the Senate in a bubble because of HIV.
That's a great point, Senator. So I'm gonna put that on a T-shirt.
You may.
We are coming up in the last stretch of this conversation. As I said before, we were supposed to have the participation of another person living with HIV to join us, and the question I was intending to ask her was about her actual personal experience with criminalization. And since she's not here, what? Oh my goodness. Apparently, we do have our guest.
Perfect timing.
This is awesome. You have no idea. Let me just tell you, we have been joined by our guest, Aisha Scott, who is an amazing advocate from Miami. Aisha, I know that you were having some troubles with your internet connection, but thank you so much for joining us. My question to you is, first of all, introduce yourself, and then I'll ask you a question.
Okay, no worries. Thank you guys for having me, and I'm so sorry about being tardy working in client service. You just never know what the day is going to be like. However, my name is Aisha Scott, as Alejandro said, and I am a public advocate, and I also facilitate support groups for women living with HIV.
Thank you so much, Aisha. And again, thank you so much for joining us. I do have a question. You know, you're someone who actually was born with HIV, and you are being subjected, as any other person living with HIV in the state of Florida, to these weird laws that say that we must disclose our status even if we are undetectable. How has criminalization come into your mind, into your life as someone living with HIV?
Personally, I was actually affected with it when I actually had my first daughter, which is actually quite odd because if anybody knows my story, you know, I didn't even find out my status until I was 15. So actually becoming pregnant with my daughter, and just at about 16, I was just about to turn 17 when it happened. And my child's father, he was actually aware, but his parents were absolutely upset when they found out my status, and it was something that I had to almost deal with, and we had to pretty much deal with together. Thankfully, his family was a little understanding. I didn't have to go through as much as many other people have as far as going to jail and all of those things, but I saw early on how tough it is, and for me, that actually changed the way that I disclosed immediately, because at that point I just felt like I didn't even want to date if I had to tell everybody or face having to go to jail or be speaking to police or, you know, just be dealing with the legal side of it. But I do know for people living with HIV, it definitely is a little disheartening because it placed the sexual health of others onto you.
Right. It gets rid of that shared responsibility.
Correct.
You know, Jason Pizzo said, sorry, I keep calling you by your full name. Senator Pizzo said earlier that we don't criminalize other diseases that we do HIV, including something like herpes, for example. And let me tell you, hepatitis C kills more people a year than does HIV, and it is not criminalized the way that HIV is. Thank you, Aisha, again for joining us and for answering that question right there on the spot. You know, when we think about HIV, we often think about, like Jason said earlier, sorry, Senator Pizzo, about, it's usually just gay guys who are living with HIV, and that is not true. Also, the fact that Senator Pizzo said earlier, not also is, you know, living with HIV has nothing to do. I mean, it does increase your chances if you're having multiple partners, but you can still have multiple partners and still be quite healthy. And aware. I want to leave these last 10 minutes of kind of a reflection on how do we really move forward? How do we get rid of this stigma? And, you know, any ideas on how to dispel, how to get rid of stigma in Florida? How do we do this? And I'm going to start with John Harris, then we're going to get to Donna. We're going to continue with Senator Pizzo, and we're going to finish up with Aisha, and then we're going to have a closing statement from each of our panel members. And John Harris.
Well, I'll give sort of a self-serving answer from the public policy lens, and that is updating our HIV criminalization laws. But it's not just because changing laws on paper will automatically make stigma disappear. The important part of that is all the public education campaign that goes along with that. It is mobilizing those advocates from around the state, whether they are people living with HIV or just those who care about people living with HIV or have loved ones living with HIV. Doing that education, normalizing talking about living with HIV, and helping educate folks on things like U equals U and what those actual risks are, how one can or scientifically cannot at all actually transmit HIV. We just have so much more to do in terms of public education that I'm excited to see how that corresponds with the progress on trying to advance that criminalization modernization policy.
Thank you, Harris. Donna, how do we get rid of stigma, especially in the healthcare community and physicians and all that? How do we? I mean, I know it's a huge issue, and we could write books, but what's your suggestion? What do you think we should do?
Yeah, so we need to really normalize and routinize testing, right? So many emergency departments aren't doing it. So many private physician offices aren't doing it. It needs to be part, when you walk in and you get your chemistry and you get your LDLs and your cholesterol and your glucose, we need to have HIV tests mandated and getting them done at least annually. I know that legislation passed that routine testing to be opt out, gosh, 3 years ago now, 4 years, it's been a while. And I'm not seeing it done to the extent out of, you hear excuses like, oh, I wouldn't know what to do with someone if they're positive. I don't know where to send them. Well, I mean, the first call is usually the health department, and every single 67 county health department in Florida has HIV services. One other thing that we need to do is some of the language. So in Medicaid, for example, the language in order to do an HIV test or in order to get an HIV test paid for by Medicaid is it has to be medically necessary. What does that mean?
Right.
You know, that's really hard. So one of the things I'm trying to constantly do through Medicaid is that's got to go. Just drop that language out of the language and just pay for HIV testing.
There is a pilot program from the Department of Health here that is paying for testing in Broward Health. In Broward Health, which is one of our hospitals in the ER. And, you know, there were some issues at the beginning with the implementation because some nurses and physicians did not want to deal with disclosing, actually revealing to someone that they're diagnosed or with HIV.
That's right.
Yeah. Senator Pizzo. Thank you, Donna. Senator Pizzo, how do we get rid of this weirdo stigma at the Senate and the House and the Capitol? How do we get rid of it somehow?
Aisha and I are going to do a little roadshow. The reason being is someone like Ms. Scott can look a legislator in the eye and say, listen, I understand, not that she understands, but for the purposes of the argument, look into a legislator's eyes who might be resistant to decriminalizing and destigmatizing and say, I know you think deep down inside that the majority of people who are HIV positive made some really bad decision in their life that you don't agree with, or a lifestyle or an idea that you don't agree with. I know that's what you're thinking.
Uh-oh.
But what bad decision did I make? I was born. Should I be considered any less of a person or not have access to less? Am I to carry around some obligation that's ridiculous and nonsensical and unnecessary that I have to live with the fear of? I mean, it's just a really simple question, because the same stigmatism still apply and attach to really archaic, weird, strange, old, antiquated ideas around this. And so that's kind of a mic dropping question that Aisha and I are going to practice as we go around each of our colleagues.
I think that you're right, that we need to bring stories that are of diverse backgrounds so that we can change minds and public opinion. And Aisha, you live it, you are in it, and I'm sure that like Senator Pizzo just said, when you share with people that you really did nothing to be living with HIV, what's that reaction like? And what do you think that people should do more of so that we can get rid of the stigma?
Well, to address people's response, normally they think that I acquired HIV from somebody from sex or just being promiscuous. unfortunately, that's just, the stigma there in itself, just how people view it. And they don't even think that I was born with it. That's not one of the first thoughts that people normally have. It's normally, oh, well, how did you catch it? So when it comes to stigma, I do believe that stigma needs to be addressed. How can we really change stigma? That is such a question that I don't even really have the answer to now. I still find myself battling with that, being that I live in South Florida, where it seems that people are so detached from HIV due to external and internal stigmas. And the reality of it is the people that are living with HIV, that are comfortable in themselves, they're not the people that are passing along the virus. The people that are passing along the virus are those who don't even want to get tested. They don't even know their status. And those are the individuals that we have to worry about. It's the ones who are even afraid to just go in there and get tested because they have that fear that they could be living with HIV. They know the things that they could have possibly done to put themselves at risk. And I think one of the biggest things, if I really had to just pinpoint something, would really just be definitely getting these laws, getting rid of them, because they do nothing to serve the community health. In actuality, I think they do the complete opposite. So I think that would be a huge first step, if people can feel like they can interact with others and have sex and not, necessarily have that full responsibility on them, because in reality we all are in control of our own sexual health, and that's the way that it should be, because a lot of us are disclosing. You have people that have disclosed and they're literally sitting in jail right now because a lover came back and said, oh, well, I might have gotten it, or later on they found out that person doesn't even have it, or somebody changed their story and now you never told them something that they've known the whole time they were dating you. So I just believe one of the first steps that really could help is probably getting rid of the laws.
Thank you so much, Aisha. That was really a great closing. We are coming into that 2-minute mark for our end. I really want to thank all of our guests today. As an educator at heart, I can also say that the best way to get rid of stigma is by educating yourself and helping educate others. So share this broadcast today. Tomorrow we will be back with another session. Tomorrow we'll be talking about HIV stigma and the transgender connection. As you guys know, the transgender community has been under attack this year, and HIV stigma added to that whole mix. We're gonna have tomorrow some great guests. I want to thank once again John Harrismauer, our policy director, Donna Sabatino from the ACE Institute. She is the director of policy. Our amazing sponsor and hopefully future governor of Florida, Senator Jason Pizzo, and our fantastic and wonderful advocate. Thank you, Aisha, once again for joining us today. I really want to thank you guys again. Tomorrow at the same time, 5 to 6 p.m., join us here. We'll have Ariana Lind. We'll have Brielle Roundtree, a transgender advocate from South Florida, and JC Roach. Once again, thank you, everybody, for welcoming us into your house today, and we will see you tomorrow. Bye, everybody. Thank you.